COVID-19 Delta variant. What do we know? The COVID-19 variant is the result of mutation of viral RNA during its duplication. Mutation is the result of an alteration of a base unit, deletion, insertion, or rearrangement of larger sections of genes or chromosomes. To scientists, viral mutation is neither new nor unexpected. They actually observe mutations every day. Most changes come and go, having little to no impact on the virus's properties. However, some changes do affect the virus's properties, such as their virulence, spread speed, disease severity, reaction to vaccine, etc. SARS-CoV-2 is a strain which has the longest RNA basis, meaning it has even more chance to mutate than other strains. So far, the WHO has identified 4 variants of SARS-CoV-2, including variant Alpha, which was initially detected in the United Kingdom, variant Beta, which was initially detected in South Africa, variant Gamma, which was initially identified with travelers from Brazil, and variant Delta. This variant was first identified in India. Scientists have identified all these genetic mutations in a special part of the spike protein, called RBD. This domain is the binding site of S protein to bind its receptor, ACE2. These mutations help the S protein bind easily to its receptor, ACE2, a protein widely presented in many types of human cells. This makes the virus invade human cells much easier. In addition, these mutations also confer increased resistance to the neutralization of vaccine-induced antibodies. Here are some facts about the Delta variant. This variant is spreading rapidly across the world and is becoming the dominant strain in many countries. According to the World Health Organization, the WHO, this variant is now detected in more than 180 countries. It's now the dominant strain in the US, UK, Russia, China, and at least 10 other nations. According to leading experts, the Delta variant will become the most dominant strain of SARS-CoV-2 globally in the coming month or even weeks. Because of its increased virulence, Delta is about 55% more transmissible than the Alpha variant, which is the previously most infectious form, and almost twice as contagious as other circulating strains. This variant is leading to more hospitalizations, more ICU admission, and more deaths. Recent data from a study in Scotland suggests that the risk for hospitalization was twice that of those infected with the Alpha variant. Symptoms of Delta variant infection. The symptoms of Delta variant seem to be little different from the traditional COVID-19 symptoms. With COVID-19, it was a loss of smell, shortness of breath, fever, and persistent cough. But a British study suggests that the symptoms of the Delta variant resemble a common cold, headache, runny nose, and a sore throat. So if you develop these cold-like symptoms, be aware that it could be more than that. Delta is more contagious than other virus strains. The Delta variant has the highest R0 value so far. R0 is a mathematical term that indicates how contagious an infectious disease is. The R0 value for the original strain of coronavirus is 2.5, while in Delta, the average R0 value of 8, meaning that a person who has the disease will transmit it to an average of 8 other people, and that replication will continue if no one has been vaccinated against the disease or is already immune to it in their community. This is an exponential growth, and even a small increase in the transmissibility will make a huge impact. The Delta variant is now among the top 3 most contagious diseases of all time, alongside chickenpox, which has an R0 value of 8.5, and measles, which has an R0 value of 12 to 18. Delta is more virulent than other variants. Chinese scientists has reported that the viral load in the Delta variant, in other words, the number of virus particles in the airways of host individuals, were about 1,200 times greater than in those infected with the original coronavirus strain. The incubation duration in patients is reduced from 6 days to 4 days after an individual has picked up the virus. The short incubation period brings additional difficulty in preventing outbreaks through contact tracing of infected people. Risk of reinfection with Delta variant is about 1.5 times higher compared to the Alpha variant. Age matters. It should be noted that Delta has also been associated with an increased incidence of COVID in younger patients. There are 2 reasons for that. Young people are more socially active, so keeping social distance is more difficult. Second, the vaccination rate is still low among young people. To fight against the COVID pandemic, the biggest vaccination campaign in history is underway. So, how well does the vaccine work against the Delta variant? Well, the preliminary data from clinical studies from the UK, Israel, and Canada can give us an answer. Clinical data from UK show that the effectiveness after 1 dose of vaccine such as Pfizer and AstraZeneca, was low in both the Delta variant and the Alpha variant. However, the effectiveness of 2 doses of the Pfizer vaccine was 93.7% among persons with the Alpha variant and 88.0% among those with the Delta variant. With the AstraZeneca vaccine, the effectiveness after 2 doses was 74.5% among persons with the Alpha variant and 67.0% among those with the Delta variant. In Canada, researchers estimated that the effectiveness of the Pfizer vaccine against symptomatic infection with the Delta variant to be 87% after 2 doses. They also found that Moderna vaccine was 95% effective in preventing hospitalizations or death. Meanwhile, Israel Health Ministry released data suggesting that with the rise of the Delta variant in the nation, the protection effect of the Pfizer vaccine was dropped from 64% to 39%, but still 91% effective in preventing serious illnesses and hospitalization. In summary, although our vaccines are not perfect, they're still very effective at preventing the most severe forms of COVID-19. The CDC has confirmed that vaccination is the best protection against the Delta variant. An important note to make is that during the fight against COVID-19, more and more unvaccinated patients admitted into the ICU with critical COVID-19 conditions had wished that they had received the vaccine. Can the Delta variant infect fully vaccinated people? Yes, it can. This is called breakthrough infection, meaning infection after full vaccination, and is because the virus broke through the protective barrier the vaccine provides. A study in Massachusetts found fully vaccinated people accounted for 74% of COVID-19 cases in an outbreak. Strikingly, the study found that fully vaccinated people carried just as much virus in their noses and throats as the unvaccinated. It may sound disappointing and many people worried about the effectiveness of the vaccine. Scientists in Singapore found that those lows declined more rapidly in the vaccinated population. In a study in Israel, even when the breakthrough infections happened, most breakthrough infections were mild or asymptomatic because of the protection offered by the vaccine. Are masks still needed? With the threat of the Delta variant, masking is becoming increasingly more important, rather less. That is because more and more vaccinated people are becoming asymptomatic carriers of the Delta variant, which leaves unvaccinated people at higher risk. So, health experts highly recommend that unvaccinated people, including children and teenagers, to continue masking. They're also advising vaccinated people to mask up to protect other people from getting infected. Each of us needs to take personal responsibility to protect ourselves and others by getting vaccinated and continue to wear a mask.